Good afternoon. As Dean and I were sitting over here earlier and listened to all the testimony from the panel members earlier, we just kind of thought, what are we going to say? Because they've just said it all. Obviously, all of us sitting up here have an interest in the work of direct care workers. My agency, the Iowa Department of Public Health, our mission is to promote and protect the health of Iowans. If that doesn't fit in with the work of direct care workers, I don't know what does. As Bruce Keppel mentioned earlier today, this is a public health crisis. Workforce shortages in healthcare are creating significant problems across the country. And it's not just physicians and nurses that we're short in. We're short in direct care workers. And unless we have the people available to provide that direct care, that frontline work, we are going to be in a dire situation. And as has been mentioned, we're in that dire situation right now. So our agency is working very closely with the Direct Care Workers Advisory Council. This is some funding that has come through our department onto the Iowa Caregivers Association for a few years now. And we worked with them on the original report that was written on the status of direct care workers. And they followed up with a second report that was presented to me in November of 2008, really with some recommendations on things that we can do within the state of Iowa to improve conditions for direct care workers, all around recruitment, retention, access to health care, certification of direct care workers, continued professionalization of the workforce. And that report is something we're going through right now, looking at it very closely and seeing what kind of legislation, maybe not this year, but next year could be advanced through our department, the Iowa Caregivers Association, that would really let us implement some of those recommendations that were put forward in the report. So from my standpoint, from the Iowa Department of Public Health standpoint, this is something we're committed to. We recognize the importance of direct care workers, the whole access issue that we're going to have around aging population, and it's something we need to continue to focus on. And we're committed to doing so and look forward to continuing to partner with DI. What is DI? I certainly found out what DI is within the first week of being on the job, and have been thoroughly impressed since. So we will continue to partner with the Iowa Caregivers Association. As Dr. Denson mentioned earlier, we're also looking for possible outside sources of funding to try and advance some of these causes. It's a tough budgetary year, and anytime we can try and look outside of the state funds, it's probably going to help us as well. So I'm going to stop talking and turn it over to one of my colleagues here.